When it comes to elbow joint complaints, people almost always want to blame the tendons. Golfer's elbow, tennis elbow. And while it's true that the root cause of an elbow complaint can be a tendinopathy, there are other root cause diagnoses as possibilities as well. I think of the neck and the mid-back as possible sources of elbow complaints. If there's a mechanical problem in one of the joints there, they can cause signs and symptoms in the upper extremities. I'm also curious about the elbow joint itself. Sometimes I find that the elbow is mechanically not moving well, and by moving in a specific direction, we restore the joint to normal and therefore the signs and symptoms abolish. When we think of the elbow joint, we think of it as a hinge joint that moves primarily in the sagittal plane, flexion and extension, and that's definitely true. But there are also lateral movements of the elbow joint that I can use for repeated movement testing. So when I use the repeated movement, we do about 10 or so, and then we retest the symptoms and the signs. Has mobility improved or not? Has strength improved or not? Has a functional baseline like turning a car key improved or not? It's a very cause and effect type of testing, and that's why I like it. It's observable. And if we don't find a mechanical problem in the neck, mid-back, or elbow joint, we can think about tendinopathies or other diagnoses. But for lateral movements, what I typically do is have the patient putting some weight through the upper extremity. It's based on the individual presentation. And instead of going straight into extension, which is often a repeated movement test I use for the elbow joint, I'll have them keep the elbow a little bit flexed, relaxed, push with a varus force, and then push straight into end range extension. So pushing out away from the body and then into full extension. And getting to end range with that overpressure is key. So there's lots of different repeated movements I can test. It's my job to listen to the verbal history, to understand prevalences and patterns, and understand what the baselines of the patient are telling me to decide which repeated movement to test. But again, if we look at repeated movement testing, we're looking for, is there one movement that when performed repeatedly restores the joint to normal, abolishing signs and symptoms? So it's not just the sagittal plane for the elbow, it can be other motions as well.